Hello friends, I'm George and I'm here to speak to you about a very unique mandibular advancement device for treating mild to moderate obstructive sleep apnea. The device is called DreamVent Pro. What makes this device unique is that it is custom made up of biomedical grade nylon, 3D printed using SLS technology, and it comes with an integrated airway channel. So the airway channel is what makes this device very unique, and along with the airway channel you can use 3 pressure valves. These are positive and expiratory pressure valves, and we call it the ExValve. So it is used along with the DreamVent Pro, and you can successfully treat mild to moderate obstructive sleep apnea, and even in severe cases when patients are not compliant to surgery or patients don't want to undergo surgery and are non-compliant to CPAP. So how do we go forward fabricating the device? So we need to have impressions, dental impressions of the upper jaw, the lower jaw, and we need to have the bite, the protrusive bite or the mandibular advanced bite. So for that we have special bite forks, which provide a 5 millimeters of clearance, which we need for the airway channel. So there are 2 kinds of bite forks. We have single-sided bite fork and double-sided bite fork, which comes in medium and large sizes. So when do you use a single-sided and when do you use a double-sided? So you will use for normal class 1 cases this double-sided bite fork, which will give you an edge-to-edge bite, which will protrude the mandible and give you an edge-to-edge bite. And in other cases where an edge-to-edge may not be comfortable for the patient, or you need to protrude more than the edge-to-edge position, you will use a single-sided bite fork. And for that you will use it in conjunction with a protrusion gauge, for example like the George gauge or any similar protrusion gauge. So you will fix the bite fork onto the gauge and take an advanced bite. So the first thing that you need to check once you examine the patient definitely, and you assess the severity of OSA using a sleep study, and once you go for the device, you will need to check whether first of all the patient has any TMJ issues or not. So if the patient has some TMJ issues, this may not be a good idea to go forward with. But if the patient otherwise is healthy, the patient is an adult and no other issues, and once the patient has had all the dental treatments done, because changing this device frequently may be costly for the patient. So once the dental treatment is done, the patients can go in for their impressions. Now we have digital impressions and conventional impressions. Now digital impressions makes things a lot more easy. So you can just take an upper scan and a lower scan and a bite scan with the bite fork in the patient's mouth. After taking the scans, you also need to take a photograph of the patient smiling in order to assess the midline. Following this, you can send all your records to info@dreamventforosa.com. To get an idea whether the patient is going to be comfortable with the device, what we can do is you can ask the patient to close onto the bite fork. So once the patient does that, the patient gets a fair idea as to how it would be with the appliance in the patient's mouth. So you can recline the patient, ask the patient to relax, and the patient can themselves feel how it is going to be with the device in the patient's mouth. So they get a fair idea as to what is to come. And with the single-sided bite fork, you can protrude how much the patient feels comfortable. So definitely with 50 to 60% of protrusion may be sufficient to start off with, and then you can titrate the bands and take the mandible further forward. So when you use it in conjunction with a George gauge or any similar gauge, you first ask the patient to take the lower jaw backwards and then forwards, protrude as maximum as possible, and the difference, you get the difference amount, and from that you calculate 50 to 60%. That's how you gauge how much protrusion that you need, and definitely how the patient is feeling with that kind of a protrusion. It will take some time for the patients to get accustomed to any mandibular advancement device, and once they get accustomed to it after a 1 or 2 week period, they're going to feel much better, and you can also assess the quality of sleep after that using a PSG or any home sleep apnea testing, and you can actually see the difference. You have 3 ExValves, the low, medium and high. We always start off with the 19 bands, okay, in the protruded position, and then we start off with the medium valve. So as you can see, the medium valve will have 4 holes and silicone flaps. You can assist the patient for a week or 2, and then you can either increase the protrusion by 1 mm using the soft bands, and if the patient needs more relief, then you can even change the valve to high. So there are different techniques to titrate the device. So either you can advance the mandible by increments of 1 mm every 1 to 2 weeks and then go for using the ExValve, or you can start off with the ExValve and then subsequently titrate and advance the mandible. If the appliance requires any minor adjustment, if it's either a little tight or a little loose, it can easily be done with the help of a flameless torch. You can clean the DreamVent with lukewarm water and with a soft clean toothbrush, not the same toothbrush you use to brush your teeth, as toothpaste can damage the device. You can also use antibacterial denture cleansers which are free from chlorine, bleach, acetic acid or alcohol based products, and soak for 15 minutes or as per the time recommended by the manufacturer. You can remove and rinse the device and the container thoroughly with lukewarm water, including the airway entry and exit points, to remove the cleaning agent. Shake the device to clear any water and ensure the airway's entry and exit are free from debris. Dry your device after cleaning and store in a well-ventilated area to allow the internal airway to dry. A 10% weight loss reduces AHI by 26%. Lifestyle interventions, diet, exercise, or a combination of the two can improve OSA by similar degrees. But even if your patient isn't motivated for it, the DreamVent Pro can definitely make a big difference to their lives, improving their quality of sleep and quality of life. So DreamVent Pro is imported and marketed in India by Nest Medical Private Limited, and the device is manufactured from Australia and Canada. So there is a turnaround time of 3 weeks. So you can go ahead and start using these devices, because I'm sure it's going to make a big difference in the lives of your patients. Choose DreamVent for silent nights and refreshed mornings.